Good morning. I am Bill Blackburn, Mayor of Kerrville. We come once again to give an update on the coronavirus epidemic and the resulting illness known as COVID-19. I know many are celebrating the partial openings the governor announced on Tuesday. And there is reason for celebration as businesses will be more open and workers will be at work. There are museums reopening and churches with people in the pews. But the celebrations need to be balanced with caution. While many are excited and want to get back into life before, it isn't life before. Life has changed. There is a virus out there that still runs on fast feet and gets in the body and quickly goes to its destructive work. As things open up, I have heard from people who are scared, people who have an underlying condition or someone in the family does. With only 5 cases in Kerr County, we can feel invulnerable. We aren't. The neighboring county has had 13 cases and 2 deaths. Another county northeast of us with much less population is seeing a spike in cases right now. We are hearing reports around the state of police and fire personnel with an increase in COVID cases. In Abilene, 36 firefighters are out with the illness, with 7 more quarantined. Am I trying to scare you? Am I being an alarmist? I am if it helps us to be cautious. It is like this virus has spiky arms around us and it still wants to squeeze. You may think those people wearing masks out in public are silly, and you are showing you are not afraid and you don't need what you think is an unnecessary prop. But what if that person is a wife or husband of a child with asthma, or someone with diabetes or COPD, or they have someone at home with cancer, or it is someone who just does not want to get sick? Maybe you will wear a mask so you don't infect them. Some have said the measures the governor has taken to fight this virus are unconstitutional. Under the Texas Disaster Act of 1975 and Section 418.001 of the Texas Government Code, the governor has significant authority to protect the safety and health of the citizens of Texas, and he has acted within that authority. Has everything been done perfectly in the response to the coronavirus in Kerr County? No, I'm sure it has not. Across the country and the world, since its first report out of China on New Year's Eve, there has been a struggle to understand this virus, how it spreads, how sick people get, and how many people could die from it. It is called a novel virus because it is new, although it is related to other viruses. We have been in uncharted waters. On January 24th, the city, the county, and the Pearson Regional Medical Center began meeting to prepare response 3 days after the first U.S. case was reported. They were later joined by the superintendent of the Kerrville schools, the president of Schreiner University, and emergency management professionals. A system of communications was put in place. Equipment was ready. First responders were ready. Personnel and space at the hospital were ready. But to be ready and with the resulting shutdown, that meant businesses and workers were hurt. And people could not carry on life as usual. That is a big cost. But all that was done, I believe, saved lives and protected health. Yes, only 5 cases and no deaths. But this story is not over. And let's hope it has a good ending. So while I urge caution, I also ask you to support local businesses. These are our friends and neighbors, and local businesses are the backbone of Kerrville. Now more than ever, let's give them our support, encouragement, and business. Thank you, and stay safe. And now we hear from the CEO of Pearson Health, Corey Edmondson.
Thank you, Mayor. Good morning. Corey Edmondson, President CEO at Pearson Health. As of yesterday, we have tested 428 people. Of that number, 20 are still pending results. That is strictly as a reminder to tell you that that is Pearson Health testing. There's still doctors and other areas that are still testing and screening patients. And as the mayor mentioned, 5 patients have tested positive, and that's still the case as to today. That's roughly 1.16% of those that we have tested. And when you look at it from a county perspective of 50,000, that's 0.0001% of positive cases. I share that with you in the fact that we are going in the right direction. That doesn't mean to let down our guard, but just to give people confidence in where we are as a community. Texas has experienced over 27,000 cases now of positive cases as of this morning, and 732 deaths. That may have increased since I last looked at the data, but that's where we are. I think communication is really important during a pandemic and a crisis like this. And one thing that's important is that you clearly communicate and ensure collaborative efforts are present by all those involved, including yourself as a community. Pearson Health is proud to work with the city, the county, the Kerrville Independent School District, Shriner, and other healthcare stakeholders throughout this COVID-19 crisis. The creation of the collaborative Joint Operations Center has strengthened communications, and we all have worked hand in hand together to keep our constituents and community informed at all times while providing cohesive and united message. Gathering facts from the right sources is important for all of us as we navigate the next step. I'll give you a couple of CDC updates in regards to guidelines, et cetera. The CDC has even updated what they consider symptomatic items associated with COVID-19. So now the list includes and has lengthened is some of these things you've heard before, but fever, cough, shortness of breath, chills, muscle pain, new loss of taste and smell, vomiting or diarrhea, or even a sore throat. Those are new symptoms that we're even screening for and asking about. CDC continues to recommend all the things to prevent you from getting that. You've got some personal responsibility for washing hands, avoiding contact with people who are sick, social distancing, covering coughs and sneezes with your elbow. All those things that you've known today are still in place, and we strongly encourage that, especially with the fact that when the governor is opening up the state, and Kerrville is looking at opening up at the level we are moving forward. COVID-19 has created some changes, and Pearson Health is making all those changes as well, and a few new changes. And from a positive standpoint, I will tell you that last Wednesday, the governor allowed hospitals and healthcare throughout the state open up for elective procedures. That was good news. The governor was feeling better about what was going on throughout the state. Our surgeons have even told us stories when we opened up last Wednesday that patients were calling them saying, "Can I be the first one on your list?" People are ready to get back to improved healthcare, improved livelihoods, et cetera. And another positive thing is with a decreased volume of screening and testing that we've done out at our Hill Country Youth Events Center, we're going to be moving that screening and testing center to our urgent care center located at 1740 Junction Highway. That's positive for a variety of reasons. One being that now we're able to do that 7 days a week because we're doing it at the urgent care center. We applaud the 24 or more Pearson employees who've made that clinic out at the Hill Country Event Youth Center possible. In such a short time, we were able to stand that up, and we appreciate the Kerr County for allowing us access to that center and providing security with the Sheriff's Department during that whole time. If you want to schedule an appointment for screening and or testing, call the Urgent Care Center at 830-258-7669. One thing that we've been hearing is that people are concerned about accessing healthcare, period. Just in general, they're scared to go to the doctor, they're scared to go to the hospital or the ER. But let me reassure you of a few things about safety and cleanliness associated with healthcare, and particularly with Pearson. We all want to, as our community resumes to some sort of normalcy, we're proud to point out the fact that there's been a concerted effort on our end and hasn't changed or wavered since COVID started. A few things to point out from a safety perspective is that Pearson Health has been named a 2020 America's Best Hospital for Patient Safety by the Women's Choice Awards in particular. And Pearson ranks in the top 5% out of over almost 5,000 hospitals for patient safety. Additionally, most recently reported, we received an A rating for safety, a hospital safety grade from Leapfrog Group that monitors hospitals nationwide. We got the top grade moving forward in the last reporting period. We're providing safe healthcare locally and are meeting all kinds of high standards in regards to that. When it comes to cleanliness, for the period of March 1st through the 26th, at the peak of COVID, Pearson was a top decile and ranked nationally for cleanliness based on patient satisfaction surveys from CMS. In fact, in March alone, we were rated in the top 2% nationally out of over 27 hospitals that were surveyed. We consistently have been ranked in the top 15% nationally for cleanliness for the past 2 years. When it comes to cleanliness and kindness, just overall, Pearson has been the recipient, and we've shared many stories with you about Kerrville Kindness. We've been overwhelmed by the depth and breadth of the support, from encouraging calls to texts to social media posts, posters, letters, everything under the sun, it seems like, from food donated to our frontline staff and even medical supplies. That love and that support energizes our staff. It reminds us how blessed we are to be in healthcare and especially being supported by our community. This week, though, I will tell you that Pearson Health stepped it up and we wanted to pay it forward. We had kind of a friendly competition going on within our own organization, and we collected canned goods, paper products, and beverages for those in need. And boy, did our staff deliver. We proudly collected over almost 1,400 or 14,000 items to be delivered to the Mustard Seed Ministries, the Doyle Community Centers, St. Vincent de Paul, and the Diedrich Center. It was extremely rewarding for our employees and a true testament that they got to experience that it is better to give than to receive. So in conclusion, we feel that we're winning this battle. It's been a joint effort and a strong united front working with state, local governments, state and regional healthcare authorities, our healthcare providers, and the entire Pearson Health family to conform to all the legal requirements, safety guidelines, best clinical practices, and we continue to communicate all those efforts on a daily basis. But through it all, Pearson Health has provided the safest environment and the best care possible. Just like you, we're ready to return our staff and our equipment back to their original positions. But we are doing that in a reasonable and rational way. We encourage you to go about your daily life as the governor opens Texas in a reasonable and rational way as well. Do your part to be respectful and prudent in your activities. We've put many new and advanced practices in place due to COVID-19, and will continue to do so during the crisis and during the challenge. And we've continually improved in the things that we do and how we grow. So I'll leave you with this quote by Winston Churchill. It's a shame to waste a crisis, to not come out of it somehow stronger and wiser. I hope you, your family, your organization will come out of this stronger and wiser. Thank you, Mayor.
Thank you, Corey. This is Mark McDaniel, City Manager for Kerrville. Just a few remarks for everyone, especially related to the governor's report to open Texas. So following the news conference this week, I'm sure most of you have had a chance to look at the governor's report. It provides a lot of guidance on reopening for certain businesses and facilities. Residents can find a copy of this report, 63 pages, on the city's website, and it provides a lot of information that will be helpful for everyone, including patrons of the businesses and restaurants. So just a real high-level summary right now as it pertains to Kerrville. So right now, the governor's related orders allow certain counties to open most businesses quicker if they have fewer than 5 cases. So Kerrville falls into that category, and the county judge has submitted the paperwork now to allow county businesses to open at the 50% occupancy as opposed to the 25%. And it's not all businesses. There are some businesses that are still not eligible, and I'll go into that a little bit. We also sent out a letter right after the governor's news conference, like the day after, to our local restaurants to share some information about what we were going to be doing in terms of moving to that 50% threshold so that they could begin to prepare their facilities to accommodate patrons beginning Friday. So, and then today, our staff is meeting with the restaurants and sending out a toolkit that we have now produced to provide some guidance to restaurants on how they would do that. We've had a lot of questions, and I think that people are well on their way to opening beginning tomorrow. But not all businesses will be allowed to open. For example, if an establishment obtains 51% or more of its sales from alcohol, they will not be permitted to open at this time. Hopefully they will in the near future, but not now, per the governor's orders. We have 10 such businesses inside the Kerrville city limits. Also, barbers and salons, gyms, and some other businesses, public pools. Some questions about what's public a pool and what's not. Basically, if the pool requires an inspection, it's considered public. So this would be for hotels and apartment complexes and other facilities that the public has access to. Just doesn't include people's residential pools. So we expect more guidance from the governor on or before May 18th about the next phase of opening. And as a reminder, no visitors are permitted at adult living facilities such as nursing homes and assisted living centers to protect that population. With regard to city operations, we'll be treating our buildings as if they were businesses in terms of occupancy and sanitation requirements beginning tomorrow. This means that we'll be open to the public for a limited number of people at a time. And it's not just about the 50% occupancy rule, it's also about social distancing. So you still have to be able to achieve social distancing even if you want to reach that 50% occupancy. The social distancing kind of preempts the occupancy. We'll also try to make accommodations for at-risk populations that are visiting our facilities for designated hours. Press releases will be coming out about those hours. All of our public-facing employees will be wearing masks, and we encourage others to do so as well. They are not required, specifically not required by the governor's orders, but they are recommended. In addition, tomorrow we'll be opening our tennis courts under certain requirements and allow single rider carts at the Scott Schreiner golf course. On Monday, we'll plan to reopen the library under certain requirements. Certain programs and equipment will not be available just because of the difficulty in keeping them sanitary, but the doors will be open for checking out books and things such as that. City council meetings will resume to a more normal format in May, with public able to attend those in person in limited numbers because of the occupancy requirements and also social distancing requirements and sanitation. Some of our boards and commissions will resume meeting in June and July. So we'll slowly begin business as usual, like everybody else. Testing. So you heard Corey Edmondson talk about testing and what the Pearson is doing. We're also going to be offering testing to the general public at no cost on a couple of occasions. The first one is coming up soon. It's Saturday, May 2nd from 9 to 5. This will be done by the Texas Military Department. It'll be done at the Kroc Center. And you have to show symptoms to be able to be tested. So this could be, runny nose, sore throat, other symptoms that are may be COVID related, and you need to have an appointment. So there's a phone number to call to make that appointment. It's 512-883-2400. You can also make an appointment online at TexCovidTest.org. That's TexasTXCovidTest.org. There'll be a press release out on that today, so I'm sure that you'll be able to see that information also in the newspaper or on our website or on social media. Finally, I want to ask for everyone's help. We are opening slowly, and if we do this right, we'll continue to open more and more over time. But if we don't do what we need to be doing, what we've been asked to do by the governor with his orders, then we may have a setback. And right now, Kerr County is in a good shape to bounce back before other counties in Texas because of our low number of cases and how we've been able to manage that. So let's all do our part to make sure that we can remain open at the 50% occupancy level, and even more as time goes on, and allow more businesses to open by doing our part to social distance, to wear your mask as recommended. Don't have to, but it is recommended. And then finally, we'll also follow up on any complaints and visit with individuals or businesses as needed. But we're not going to go about this with heavy-handed enforcement unless it's a very serious situation. We have not to date, and we're not going to start now. But we are, again, asking people to do their part, be responsible, do the right thing for everybody in our community. So with that, Mayor, I'll turn it over to the next speaker. Thank you. To Gil. Okay. Gil Salinas, I think you're up next.
All right. Thank you, Mark. At the Kerr Economic Development Corporation, we continue to assess our local business climate, industry, and our local entrepreneurs. We've done this through several measures, but most recently, we conducted a survey to determine the economic pulse of Kerrville. And I'm glad to announce that we are trending in a much better direction than our national counterparts, and for that matter, for most communities here in the state of Texas. However, we are going to feel an economic impact of sorts. It's just not as bad as it could potentially be. We polled more than 150 businesses in the Kerrville area, from small mom and pop shops to much larger organizations. And this was done through a non-scientific survey. We found that more than 50% of the businesses that were polled actually applied for federal funding. And the majority of those that applied were approved and have received their funding already. So we congratulate those businesses that went out and did that. 84% of our businesses that we polled have remained open during this epidemic in some sort of fashion. 16% of them said that they were either forced to shut down or they just voluntarily said, we're just gonna close the doors until things get better. And a handful of businesses did say that they only had 3 more months capacity to operate before they would permanently close. So we are in constant communication with some of those businesses. But as a result, all businesses have said that they have implemented or are implementing social distancing measures specifically for their customers and their workers in anticipation of tomorrow's opening of the economy. Now, a little bit on economic resiliency. Rebooting our local economy starts with the consumer. It starts with you and I, and that actually starts tomorrow. We need to be able to support our entrepreneurs, our local businesses, and really take advantage of that 50% rule. You just heard our city manager mention that 50% occupancy rule, as opposed to many other communities in the states are at 25%. So that helps us tremendously. And we as consumers, we have that purchasing power to help kickstart our economy, really drive our economy forward faster than some other areas. So again, shop local, invest in our entrepreneurs. I can't stress this enough, just at least for 1 more month, resist the urge of going online and buying or shopping and try to spend your money or invest your money locally. That is the way that you and I are gonna help bring hundreds of people back to work in a relatively short period of time. So We thank you for doing your part, and don't forget to thank a frontline worker today and especially tomorrow when most 50% or at least a lot of our businesses are going to be reopening at 50% capacity. Thank you.
All right. Thank you, Gil. And at this time, we're going to hear from Jonathan Letts. Jonathan is a county commissioner and a Kerrville County businessman. And Jonathan, if you'll tell us about it.
Okay. Good morning, everyone. I'm here this morning on behalf of the county judge who has a full probate docket today. He's getting geared up to start his judicial functions again and asked me to sit in. One of the things I do want to comment, I want to commend both the mayor and the county judge. They have talked throughout this period and continue to talk almost on a daily basis. The cooperation has been phenomenal between the city and the county during this whole crisis, and I think it will continue. So I think that just want to commend both of those individuals. Clearly, the community is ready to open. I've heard it from a lot of businessmen, business leaders, as members of the public. So I think we're going in the right direction. But I think everyone needs to remember that safety is still a priority, and the success of the reopening is going to depend on the public. Following the rules, following the social distancing, wearing masks, and just following the process that's been set out by the governor. I think that we've been very fortunate so far. I think we'll continue to be fortunate, but we need to be vigilant and continue to just follow the rules. Monday, Commissioners Court will be looking at reopening the county. How we're going to do that, we'll be talking to the various elected officials, and they will have obviously be in control of their own offices. I have talked to some already, and they're beginning to figure out how we're going to open. Not every department is going to open right away, certainly, and we will do it in a slow process to ensure the safety of both the public and our employees. That's really all I have this morning. Appreciate everything that's been going on, and just again, back to the public. The success of our reopening depends on them being safe and following the rules set out by the governor. Thank you.
All right. Thank you, Jonathan. And now we're going to go to Charlie McCormick, president of Shriner University, and then Mark Foust, superintendent of KISD, will wrap it up for us. Okay, Charlie.
Thank you, Mayor. Through May 17th, university offices in Kerrville, El Paso, and Brownsville are staffed by only essential employees, and all other employees are performing their duties from home. We will reassess the situation on May 17th and look at ways to systematically bring our employees back to campus in the safest manner possible, including wearing masks. At this time, Shriner University intends to be back as a residential campus in August for the fall 2020 semester. And while circumstances beyond our control may change these plans, we are aggressively pursuing strategies that will allow us to safely return to a residential campus. By June 1st, it's our intention to release our plan to implement a safe reopening that follows the guidance from federal, state, and local governments, as well as from public health officials. I want to take a few of my minutes this morning to extend a sincere thank you on behalf of Shriner University's entire graduating class to the City of Kerrville and Kerrville Parks and Recreation for the congratulatory messages throughout downtown and Louise Hayes Park. This experience has been especially hard on our seniors, and this show of support is deeply appreciated by all of us at Shriner University. It's currently our plan to hold baccalaureate and commencement ceremonies for the spring 2020 graduates in August on the 14th and 15th. And using the latest information available, I will again communicate with students on June 19th in order to confirm or change these graduation dates. Shriner University presented the Communication Design Senior Exhibition on April 27th. Due to social distancing, exhibiting the seniors' work at the Kerr Arts and Cultural Center, which typically hosts this event, was not possible this year. And therefore, the senior shows have been moved to an online format, and the exhibition can be viewed at shrinerdesign.org. In these challenging times, a Shriner University alumnus and current member of Shriner's Board of Trustees, Carl Ransleben, is providing extraordinary support to Hill Country students by matching dollar for dollar up to $250,000 any funds raised by Shriner between now and May 31st. And though the campus is quiet now, we look forward to welcoming employees and students back as soon as it is safe to do so. And we look forward to having all of you back on campus at that point too. Thank you, Mayor.
All right, thank you, Dr. McCormick. And now, Dr. Mark Foust from KISD.
Hi guys, thank you very much. As our community knows, the governor has ordered school closures through the remainder of the school calendar for this spring. For us, that last date of virtual KISD is going to officially be May 29th, which is the last Friday in May. We are going to continue our meal program throughout the remainder of this semester, and we're working on plans now to transition that meal program and still offer some meals over the summer. It may look slightly different. We're working on what that looks like. We'll share that information with the community as we move into the summer months. We too are very concerned about our seniors and have communicated with them some. We know there are a number of milestone experiences that they have missed out, and we've shared with our parents and our seniors that it's our desire to try and have a traditional graduation ceremony at some point this summer. We recognize that's not going to happen in May. We're looking at some alternate activities for the May 29th date, which would have been our Tybee High School graduation. But we are planning for and hoping for the freedom to be able to have a graduation ceremony late this summer. So we're looking at a more realistic, that's a July date, more news to come as our situation unfolds, which gives me the opportunity to echo what you've heard from a number of folks here. We're excited that Kerr County is a governor's phase 2 county where we're opening with 50% capacity. What is really important in our mind, and this is selfish, this is about our seniors and really wanting to have that graduation ceremony this summer and move back into that normalcy, is that folks through this next phase in our community really honor the precautions that are being prescribed. So to echo what my friends here have said is please, let's be very safe and cautious as we move into phase 2 and 50% capacity in our retail locations and in our restaurants, and use every precaution that's available so that we don't move in the wrong direction as a community, that we keep those cases of COVID-19 incredibly low in our community, and we maintain that phase 2 status and hopefully move into the next phase that the governor is going to announce later this month. So having said that, that impacts our opportunity at graduation. And so please think about our seniors, think about the Schreiner University seniors, and think about our kids that want to get back into the school buildings in August, when you think about how we operate over these next few weeks, I would say. The other thing I would share is we don't yet know what summer school is going to look like because of those restrictions. We may be offering opportunities virtually for summer school. And we think there's a high likelihood that we're not permitted to operate face-to-face in June. So we'll be sharing more information with our community on summer school plans. The last thing I would like to talk about is an update. We've lost a considerable amount of instructional time. And I want to tell the community what our parents, our students, and our teachers are doing right now through virtual KISD is incredible. The amount of stress on parents, kids, and teachers is probably hard to imagine if you're not in the situation, but this is by no means an easy feat. And we are very proud of our staff and what they're able to do for our kids. We're also incredibly proud of the vast majority of our students that are actively engaged every day, and the parents that are finding time and ways to support their students' instruction. They're learning a lot about what teachers are doing right now, but our teachers' hearts are troubled in the uncertainty of, are we able to reach our kids? Are we getting the best learning opportunities to our students? And it's just an incredible amount of stress. So we ask for that continued patience in all directions, and prayers for our staff that we finish these last few weeks of the school year strong. If you look at our KISD website, you'll see that campaign, hashtag Finish Strong KISD. And it's just called for because this is a really hard and stressful transition to virtual KISD. So thank you for that support. But I'll also close by saying we are modifying or looking to modify our school calendar for next year, an earlier start date, an earlier end date, and 5 additional instructional days within the calendar. We're reducing some of our professional learning and some other days within the calendar in order to add some additional instructional days for next year's calendar. It's called for with this virtual KSD and loss of instruction. It's called for to try to remediate next school year. So more information will be shared with the community regarding the KSD calendar for next school year, and that should be available in the next couple of weeks. So again, thank you for the continued support of our students and of our parents and our kids. We're all in this together and working really well together, but working really hard through closing out the school year on May 29th. Thank you.
All right. Thank you. This concludes this press conference. The purpose is to communicate with the community about what is going on, the cooperation among these leaders and others. And I will assure you, these folks are deeply committed to this community and wanting to ensure that we are a safe and healthy community. Thank you very much.